All right. We got one patient. All right, oh, that's the broken windshield. All right. Hey, you okay? Is it a male or female? I'm assessing the car. Do I see any drugs, alcohol, anything?
No.
Alcohol. Perfect.
This beer bottle.
Okay, I'm going to look at the back since they're prone now. Do we see anything on the back? I'm exposing real quick. Anything on the neck? What we got here? No other bystanders, any family?
No.
No other?
Who's driving myself?
All right. Do we know any history on this person? Let's go ahead and somebody. Hey, give me a backboard. Yeah, I've got somebody hold seat fine. We've got the backboard. Take the headlocks off. All right, roll it over here. Come here. We're gonna roll towards me. All right. General impression. He's unconscious.
Yeah.
Okay. Alert to pain.
Yeah.
He's alert to pain.
Yeah.
Okay.
Only pain though.
Only pain. All right, and we don't see anything on the back, correct?
Nothing on the back.
Okay. On the count of 3, we're gonna roll. Okay. Go ahead, take it. 1, 2, 3. Roll.
Ah, that hurts.
It's okay.
Sorry.
Oh, so he's awake.
He's alert.
Alert to pain.
Just the pain.
Keep holding. I'll pain fully responsive. All right. All right. Expose. All right. We already do is checking the front. Rapid. As he does that, I'm gonna take some vitals. Okay. Decap ETLS on the head.
Nothing. There's an abrasion.
That's just an abrasion?
Yeah.
All right. Anything decap ETLS on the neck?
Here, so I'm going to
check chest.
No.
Shoulders. Flail chest. All right. Give me some bulky dressings. As I'm doing
Fix up this.
the vitals. Anything in the abdomen? Decap ETLS?
Nothing in the abdomen.
No abdomen.
No, as I'm doing the vitals, I'm checking PMS here and pulse. Do I have a pulse?
Yes.
You have
All
a
right.
pulse.
What's the
Closed
cap
femur
refill?
fracture on the right.
Is fine.
It's good. All right.
Okay.
Any
Open on
bleeding
the
around?
Any bleeding?
Closed femur on the right.
Yes.
I'm
Open
just
on the
doing it
left.
here Open because on we're the assessing
left.
the vitals.
Okay.
There's bleeding here?
Yes.
Where? Is it a lot?
No.
Do I have pulse?
it's fine.
No? Okay.
Yes.
I'm
Got
not
pulse?
going to worry about that.
Yes.
All right. Is he moving at all? I'm going to do Babinski test. Anything? Any
Yes.
response? Yes? Okay. Upper extremities?
Yes.
Checking the
Pulse.
vitals.
Pulse.
What's my blood pressure?
Blood pressure is 140 over 90.
Other extremity? Pulse?
Let's check that one, yeah.
Okay. Medical alerts? Bracelets anywhere? Neck?
Yes. So you ran over the paper.
All right. What's Okay, my heart that's rate? a diabetic type 1?
All
All right.
right.
How's my pulse? We're going to call for ALS. Do we need
Your heart rate? No, your heart rate
we
is
need to get the
regular,
sugar?
but it's 140.
Does he have a glucometer in the car or anything?
Yeah.
Is it weak, strong?
All right,
I'm
that's on the
going to look at the glucometer. Does it have a recent reading?
Yeah.
It's
We'll go with this
Let's
time
go
of day.
It's 28.
At noon, he was 98.
respiration
98.
32.
And then at 5
Flail
o'clock,
segment.
he
Flail
was
segment?
88.
I'm going to call dispatch. All right, I'm going to notify them of a trauma alert. Okay, it's how far are we to ORMC from here?
15 minutes.
15 minutes.
On the left side, you said?
Also
Left side,
call
yes.
and get air care on standby.
Okay.
I'm giving him. I'm actually. Let's go ahead and get an under breather on him. Yeah, let's
on
put a
with
city
the
collar
blood
on
pressure.
Yeah.
a flail segment on the left
You have it
side.
closed on the right.
Respirations again. What was the heart rate? The respiratory rate.
Respiratory is 32.
All right, and he's responsive right now.
Painful stimuli.
Okay. You know
Not
what,
awake.
sir? How you gonna? I'm gonna attempt because he's not actually, completely alert. I'm gonna try to secure the airway. I'm gonna try. Let's do an MPA. No head trauma. Besides this.
No, nothing except that.
You know what? I'm gonna go with an OPA because of the forehead. There's a possible chance.
Yeah.
So I instead of OPA. Then I put the under breather on. A 15-liter SO2. We measured it from the mouth to the corner of the ear. Insert it upside down. Boom. Now we got a secure airway. Respiratory rate again. Sorry.
Respiratory rate is still 32, dropping though.
All right.
25.
Any difficulty breathing when we assess it? Is he complaining of any of that?
He's got a flail
So
chest,
he's-
so
he's a flail chest.
we've already bandaged the flail chest. Yeah, we've got bulky directions. Okay, let's go ahead and secure him.
We got an under breather on. A 15-liter SO2.
We've got an MPA in.
All right, so he can talk to me. He's only alert to painful stimuli.
painful stimuli.
So you're probably not gonna get a history. At this point, you gotta assume for the worst. You already checked the sugar. You said when you were doing it.
Sugar,
I don't have
sugar
one
is
since
20.
noon, so it
Oh.
doesn't
Okay,
matter.
that's fine.
We're transporting now. We're gonna get him in the back of the rig and get rolling. All right,
he
we've got
is-
him on O2.
No. That's in the truck.
At this point,
Is he complaining of pain right now? When we're not touching him?
Yes, he is.
Yes.
He is. All right.
His bottom, he
What
says
does he
his
have
legs
here?
hurt.
This is
He
an
can't-
open
his legs
fracture,
hurt.
open femur.
His right
And this is a closed femur.
is shorter.
kind of
Okay. When I touch this leg and I touch this leg, which hurts more?
The right one.
The right one. All right. We're gonna put a traction splint on this leg. Can we get the traction
On the open
splint?
one?
Yeah.
That's
Try to close this up. Get some bulky dressing, some moist saline on that too.
Okay.
All right, how is this? We're gonna do a detailed assessment now.
I'm checking pupils. How are my pupils?
Pupils are
Equal and reactive.
How's the bleeding in the forehead?
bleeding. It's fine, but it's a little tender.
A little bit. All right, we'll just put some dressing there. It's not life-threatening. I move on. Boom. All right, how's his airway? He's now.
His airway is fine.
We only have one
We
track.
got the OPA on. We got non-breathe.
Voice dressing? About 15.
Moist?
About 15.
Okay, that's good. Then we move on to our circulation. How's the circulation? This is my presentation right now. Like the skin and
He's actually a little pale, but
a little pale. I'm checking for radial pulses.
Another one.
Present still.
yeah.
What's the rate? Not necessarily the rate, but is it fast? Is it still fast or slow?
It's slowing down to about 70.
All right. And what about any bleeding on the any other extremities or voids, anything like that?
Well, there's.
All right, I want a full set of vitals.
All right. So as they do that,
Oh, we're in the truck. We're moving, right?
I'm continuing.
All right, so now the
We were in the
respiratory
truck
is at
5 minutes
6.
ago.
All right. He's gonna take some vitals. I'm gonna continue my detail. You said there was a flail segment to the left.
Okay, there is a carotid pulse.
Okay,
but
what's the rate?
His respiratory rate is at 6.
No. Okay. All right. Give me a
It was
BDM.
15.
His pulse rate is now 50.
His pulse rate's what?
Now 50.
His pulse rate is 50.
You said
His
respirations
respirations are 6.
Okay, so we're gonna back. I thought you said 15.
He said 15.
He did say
Yeah.
15.
15.
Okay.
50.
Respiration.
No, respiratory. Oh, that's,
Yeah, that's what I
no,
mean.
that's 6 now.
Okay.
Six.
Respiration
Respiratory
is
is
6.
Another bandage.
Pulse is 50. Okay.
Respiratory is 6.
Okay. Cap refill.
No, it's
No pulses here.
No
No pulses here.
No pulse.
Okay.
Distal pulses.
Do I have equal expansion and equal lung sounds on both sides?
It's
There's a flared chest and
I've got,
that.
I've got them
Spanish,
both.
so yes.
I've got them badged up. All right. So do I have equal expansion on both sides
Yes.
now?
All right.
Okay. I'm also going to palpate his abdomen. Anything in the abdomen?
it's a little tender on the
diabetic.
left side, but
Little tender on the
I'm
left
taking the
side.
blood pressure now.
yeah, blood pressure is at 70 over 45.
Can,
70 over 45.
I'm looking at the front of the vehicle.
I'm gonna elevate the legs.
Glass everywhere. Glass everywhere because he came through it, right? Did I see anything on the front of the truck? Any kind of? Just where he hit the wall. Okay.
We're elevating the ledge because he's going into shock. We're BLS. We don't have any IVs or fluids. He's going into shock. He's unresponsive. We're bagging. We check the blood pressure, the vitals. We're stabilizing all the little details because we're doing we did the detail assessment.
Retraction spreading.
His back boarded. How's his PMS right now?
PMS is fine.
All right, I'm gonna give a radio report. Let me see a radio. My vitals here. Oh, okay.
Now he's in the code.
He's coding now, so let's start CPR. All right,
Go ahead and do CPR.
CPR. We got bagging going on. Give me a
We're
combi
checking
tube.
for a pulse, confirming there's no pulse.
No pulse at all.
There's a combi tube up in there. Let's put an advanced airway in if we can.
You're about 6 minutes away.
6 minutes away. What's the closest hospital?
Still on their way to RMC.
What's that?
3 minutes is the closest hospital.
3 minutes to the closest, and I'm still 6 minutes away from RMC? Yes. All right, I'm going to call the dispatch and let them know we're diverting to the closest hospital. Rescue 61, Florida South, working a code. We should be there in about 3. How do you copy?
Copy, Florida Hospital Northwest.
All right, this is Rescue 61. We're en route with a male patient, approximately 38 years old. He was involved in a vehicle accident. He was struck. He has multiple open fractures. He's backboarded and C-spined. For precautionary reasons, had a couple abrasions. Currently working a code. We're attempting an advanced airway now. We're doing CPR. Got the AED hooked up. We've got traction splints on, and we should be there in about 3. Do you require any further?
Stop the bagging.
No. Come on.
32.
What?
No, it's telling him to come.
Analyzing heart rhythm.
Now that we're doing a code, you're
Do not
just doing
touch the patient.
30 compressions, 2 breaths.
I thought it was okay.
Okay, go ahead. 2.
Is he?
Shock advised.
Okay, everybody
clear?
I'm clear. You're clear. We're all clear.
Stay clear of patient.
Shock.
You gotta wait till
Shock delivered. Go
Deliver
back into
shock
CPR.
now.
No,
Press
no,
the orange
it's
button
slow.
now.
Oh, Jesus.
Go ahead, shock him. Deliver it.
Shock delivered.
All right, CPR. Go.
Good.
4. Start
That's the old
heart.
one.
It's not loose. It's actually harder to push in.
All right, we're gonna assume that we have the advanced airway in. It's
Okay, you
not
put it
loose.
in, inflate the bag, auscultate the apex, then the lungs.
Now, continuous CPR. Continuous CPR every 5 to 6 seconds. All right.
here.
All right,
We're at the hospital.
You're at the hospital.
All right, you're my nurse. All right, we have a patient, 38-year-old male, who's struck by a vehicle. He was thrown out of the windshield. CPR in progress. We've got a King 2 in place. We've got a traction splint on the left side, open fracture.
What's the
We've got
ratio for CPR again?
it spread out. We've got the
Okay, how many cycles?
femur fracture on the right side. It
What do
was
you do after the sixth
splinted.
cycle? When you have an
Initially got on scene. He had pulses, responsive to pain, started coding, went into
when you have
full
an endotracheal tube, then
cardiac
you
arrest. We started working the code.
and you do 6 to 8 seconds, so 8 to 10 breaths per
That's
minute.
what I got for you.
do
We got
it
a flail
continuously,
chest. We
and that's
fixed
2
the
minutes.
flail
If
chest.
you don't have an advanced
Got a couple
airway,
abrasions.
it's still 5
Nothing on the
minutes.
back
You do
that we
5
saw.
cycles, and you reassess.
Awesome. Anything?
5
Good?
cycles, and you reassess, and then
All right,
if there's
we're
a
done.
pulse, then you continue to do 2 more minutes.